Transesophageal echocardiogram basics part 2. This involves consenting the patient. Please refer to basics part 1 for indications and contraindications of TEE. So when I'm consenting a patient for a transesophageal echocardiogram, we need to make sure that we're not using any medical jargon. So I tend to use the term food pipe and esophagus interchangeably, since sometimes patients believe that we're going through their windpipe or their trachea. So, I'll read this directly. We need to take better pictures of your heart through your food pipe, which runs directly behind the heart because of your mitral stenosis or your mitral regurgitation or your aortic stenosis. I explained that first we're going to numb up the back of the throat, we'll line your side to give you medicine to make you sleepy, and then once you're asleep, we'll pass a soft, flexible tube through your food pipe, not your windpipe. The procedure takes about 5 or 10 minutes, and the risks of the procedure are the following. A 1 in 1,000 chance of injuring the teeth, throat, gums, stomach, or esophagus. This was why I was asking all the questions when I came in regarding difficulty swallowing, problems with sedation. There's always a risk with sedation, and this is why you're on a monitor, and we have an ICU level nurse for this with the procedure. So if the patient is sicker, such as they're needing oxygen or has grade 1 varices or has had prior esophageal surgery, we may say, your risks are a little bit higher than the average patient. And so I use this opportunity to kind of highlight those slightly higher risks and make sure that they're on the consent form as well. And then lastly, don't forget to form a timeout prior to giving sedation. So this, again, is not the nurse's responsibility. This is the fellow's responsibility or the physician to do this ahead of time. So what about esophageal varices? This is difficult. At my teaching institution where I trained at the University of Michigan, it was taught that grade 1 and grade 2 varices were okay. This was a retrospective study involving 4 years of TEE at another institution. And basically, they had to have an EGD within several years of a TEE. So this really isn't up-to-date information, but they had found that despite patients having both large and small varices, there was no difference in bleeding outcomes, and at least in this study. I tend to, if there is some thought that there might be higher grade varices, or if there's any thought that there's gastrointestinal bleeding, then I would strongly recommend an EGD prior to a transesophageal echocardiogram. So be sure to see my next talk on moderate sedation.